International Symposium on HIV Medicine. Today, we hope you will enjoy the two main sessions we have on STI management in children and adolescents, and also on the life course of young people living with HIV. We also have a special event during the break that we hope you enjoy. We have some visitors from the Faculty of Fine Arts who will be doing a performance expressing themselves on the viewpoints of youth, which we hope will resonate with many of you today. I'd like to introduce ourselves. Professor Tanyawi Pootanakit, who is Chief of the Division of Infectious Diseases and Vaccines in Pediatrics at Chulalongkorn University. And my name is Natalie. I am a pediatric infectious diseases doctor as well at School of Global Health, also at Chulalongkorn University. So our first section today will be on STIs and young people, and we have three speakers today. Dr. Rossaphorn, Dr. Patariya, and Dr. Natcha. So the first half we will run through until 2:45, after which we will have the performance, a short break, and after we come back from the break, there will be a session on comprehensive care for adults with perinatally acquired HIV.
So I think this session will be a good platform for us to attend. So before we beginning, can I do some like manual poll? We would like to know where you're from, which area that you work, so we can make sure that we can make it interactive and meet with your expertise or your day-to-day clinical work. So who works for the pediatrics patient? Ooh, adolescent. Adult. Oh, we have a very good mix. It's very good because I think the key thing is a life course of living with HIV or adolescent or a young adult that we serve. So we hopefully that this session will suitable for your interest, and also we are very welcome you to share your thought and also share your experience from where do you work. So another little poll is that who are come from, I saw many friends and colleagues from many countries. So who are from Vietnam? Vietnam. Oh, thank you. Philippines. Some place, not Philippines, not Vietnam, and not Thailand. Yeah, from many countries. So I think from Cambodia, from UK, from US. So I would love you to share your experience or your viewpoint, because what we present might be suitable or applicable for some settings. But when you are working from different settings, of course, you will have some things to share and also to learn from each other. So let's start with the first speaker.
Yes, so we'd like to introduce our first speaker. Dr. Rossaphorn is Chief of the Bangkok STI Center, Bureau of AIDS and STIs, Department of Disease Control, under the Ministry of Public Health. She's a board-certified dermatologist and preventive medicine physician, and she's been a principal investigator in many international STI clinical trials, most recently for the novel gonorrhea treatments, and has worked with WHO on enhanced gonococcal antimicrobial surveillance program in Thailand, and previously also worked with the Thai Ministry of Public Health on EMTCT and elimination of congenital syphilis transmission, and currently is on the board of the National Writing Guidelines for the STI policy. So today she'll be speaking to us on prevention of congenital syphilis. So welcome to Dr. Rossaphorn.
Good afternoon, everyone, and thank you for inviting me to be here. Today I will present about the prevention and control of congenital syphilis. And this is outline for my topic. So first I will talk about syphilis and congenital syphilis situation, and then I will discuss about what is the reason Thailand has a rising trend of congenital syphilis. And lastly will be about how can we prevent congenital syphilis. So WHO estimated that there are 374 million cases of bacterial STI worldwide, with syphilis ranking as the third most common bacterial STI. As you may know that the increasing trend of syphilis has been observed in many countries, not only high-income countries, but also low to middle-income countries like Thailand. So this is a data from 506 report to show you that there is a high prevalence of STI among youth during 15 to 24 years old. You can see this graph that blue line represents the case of syphilis. So there is an increasing trend of syphilis during last 10 years. Since 2021, syphilis was reported more than gonorrhea cases reported in Thailand. So right now, number of confirmed syphilis cases has been reported in many groups, especially in MSM, who have concurrently have HIV infection. However, CDC indicate that women are the second most affected group from syphilis after MSM. So right now, the reemergence of a syphilis epidemic among key population and pregnant women is a global health concern. Syphilis in pregnancy leads to over 355 adverse birth outcomes each year. 21% have stillbirth and early fetal loss, and 16% have congenital syphilis. So when we talk about the prevalence of congenital syphilis, we need to go back and see what is the prevalence of pregnant women with syphilis. So in this slide, I show you the prevalence of pregnant women with syphilis in Thailand during 2012 and 2023. So from blue bar, you will see that this is represent of pregnant women with syphilis, that is Thai, and orange bar, that is non-Thai, and gray one, that is total number of the syphilis cases in pregnant women. From 2017 to 2023, you will see that there is an increasing trend of syphilis, which is a 6.5 times increase over the past 6 years. So this rate is according to the rate of congenital syphilis that present in the same times. So actually in 2016, WHO certified that Thailand had eliminated mother-to-child transmission of HIV and syphilis. In that time, Thailand reported a new case of congenital syphilis, less than 50 cases per 100,000 live births. But right now, you see that in 2023, the latest number is 189.4. So how can we prevent and control of congenital syphilis? The WHO states that early test and early treat can prevent syphilis in newborns. So what is the reason that Thailand has a rising trend of congenital syphilis? Do we have the low coverage of syphilis testing? Or do we have the low treatment rate of pregnant women who have syphilis infection? I will show you the data. So this is the data from Ministry of Public Health, show the coverage of syphilis testing among pregnant women. The gray bars show the number of women attending ANC, that you will see that each year we have the lower number of pregnancy. And the blue bars present the women that attending ANC and get tested. You see that we have the high number, it's reached to 99.5% in average, that we can have a good coverage of testing. And when we see about the coverage of treatment, we have seen that for the people who have been tested in gray bar and people who have been treated in blue bar, it's not so different. It's quite the same. And the percentage of the coverage is quite high, to 98% in average in each year. So you see that the black line is not changing to the line. So with the high coverage of testing, with the high coverage of treatment. So how can we explain that why Thailand still have a rising trend of congenital syphilis? This is why we have implemented to verify congenital syphilis, and then you will see that we have a second line to report, that is a blue line, that is a new number of congenital syphilis that we report to WHO, and having the root cause analysis to tell the country that why we have the problem. So this is the report that we create parallel to 506 report, which you will see even it's in Thai, that you will see that we have many data about neonatal data, maternal data, and also maternal partners data, which is include blood testing and also treatment. And then the expert team will verify in each case and tell us which case is congenital syphilis. So today I brought you the data about antenatal care and treatment profile of reported congenital syphilis cases in Thailand in 2022. The total number of congenital syphilis cases are 352 cases that has been reported in that year. You will see that we have around 10% of congenital syphilis cases came from mothers who have no ANC, and around 55% came with late ANC. So when we see the coverage of screening, as I have mentioned before, that we have the high coverage of testing for syphilis at least once. Yeah, but see the data, we have the lower coverage of second screening in third trimester. That is only 15.6% were screened at gestational age 28 to 32. So it means that only one time screening in the maternal cases for congenital syphilis. And when we see the maternal syphilis treatment, around 30% of maternal syphilis treatment, 30% is occur in congenital syphilis case, but around 57% they will have treatment less than 30 days before delivery, or having treatment that not penicillin. You will see that there are some number extra from the patient that have no ANC, that they report that having ANC but also have no treatment during ANC also. Let's see the congenital syphilis treatment, that is the neonatal part. You see that even on pediatric side, we have the complete treatment only around 86%, and around 13% patient of neonatal cases do not have treatment or having inadequate treatment. So this is a maternal factors for the mother who reported having congenital syphilis. Around 67.4% they are less than 25 years old. So this is important data, and also the people that are under 20 years old, 58% of that, they are not students. So it means that they are outside school. So 92% they are Thai, and we found they can see the in every gestational age, G1, G2, or G3, and we found that we have the lower data for paternal blood tests, and the one reason because of they cannot be reimbursed on that year. So in 2022, NHSO has expanded the syphilis screening coverage to partners and husbands of pregnant women as a part of UHC, Universal Health Care Coverage. So we hope that this number will be better than this year. Let's see the neonatal factors. We found that male to female is 1:1, and we have 3 cases of stillbirth, alive 99%, 22.6% have preterm birth, and we found the coverage of RPR testing at birth is 93.1%. And as I mentioned before, like 19%, they have no treatment for the baby or do not have inadequate treatment. And that is a case that have alive and congenital syphilis. In this slide, I will give you some detail about this case that we have stillbirth in 2022. Actually, we have 3 cases, and the 4th case come after October, so that is a shift to the case in 2024 fiscal year. So you will see that all the cases are under 25 years old. It's just 20, 18, 23, and 16. Let's see the first case. So this case comes with an early ANC GA at first. ANC visit is 5 weeks. Unfortunately, she had infection during pregnancy. So this is represented with a sign of secondary syphilis with a palmoplantar rash at the GA 31st. And in that day, she came to follow up for the second screening. So doctor found that she had high RPR and decided to terminate because they want to keep the baby. But during the terminate, the baby was not alive. For the second case, this case is G1P2, and the first ANC is quite late, 24 weeks, and it found that RPR is 1:64, but she did not come to follow up later and lost to follow up and come again during 29 weeks with fetal death. For the third case, this is G3P2. This is having ANC at the clinics, and it found that patients did not come to have treatment at the hospital. And lastly, after treatment at GA 20 weeks, so 3 weeks later, her baby is not alive. For the fourth case, you will see that she got the late ANC and also have active infection because have lesions and also high RPR with 1:256. And then after 2 weeks later, also the baby is not can be death fetus in utero. So those are the 4 cases that we analyzed and found that they can have like active infections, or they can if when they do not get the test result within 1 day, it can lead them to lost follow-up, especially the patient that have younger age. So in Thailand, we have the strategy of syphilis prevention and control congenital syphilis. We follow RRTTPR, that is reach, recruit, test, treat, prevention, and retain. But those strategies cannot be true or cannot lower congenital syphilis without coordination. We need some coordination with other organizations. We need CBOs to help us to reach non-Thai people, to reach high-risk women who have less than 25 years old that not are in school. We need teenage pregnancy support if they have pregnant during young. How could we recruit them to have early treatment and early testing? So it needs to help together to promote ANC campaign to decrease no ANC and have early ANC. We need help from Ministry Department of Health to have same-day test and same-day treat. We need help from the Royal College of Pediatrics, Royal College of Obstetricians to help us to bring it through from the campaign same-day test, same-day treat among pregnant women, and we need to update the guideline also. And how could we stay prevention and retain with the follow-up after treatment? This is a key important thing. So in conclusion, the syphilis epidemic is accelerating worldwide. A major victory in the fight against syphilis has been the implementation of same-day testing and highly effective antibiotic treatment in both pregnant women and her partners. Most of pregnant women with syphilis are younger than 25 years old and not in the education system. So we have the low coverage of syphilis screening during third trimester. So how can we improve that? And it's quite challenging to reduce the rate of congenital syphilis if there is a high prevalence of syphilis in our population. Thank you very much, and I would like to invite all of you to Point of Care Conference here in Samyan Midtown in June. Thank you very much.
Thank you so much. And have any questions or comments? I have one question, Ka. When you talk about that it have a specific group of teenage pregnancy or a mother less than 25 is a group that is likely to have cases of syphilis. However, how to make the same-day test and treat for syphilis occur in antenatal care the same way that we try to do same-day test and treat for HIV, because I think it's quite a key, because even though sometimes you get tested, but you lost to follow-up, or it takes time before coming to the next antenatal care, and the baby might have stillbirth or preterm and not have enough time. So should we change to rapid testing in antenatal care for this special group, or how we can make it happen for earlier test and treat for syphilis in young pregnant women?
Yeah, I think it depends on the hospital. Now, after we implement this, we found that some tertiary care that have like more cases in ANC, they can implement one-day test and same-day result with using reverse algorithm by using machine, but not rapid test. But maybe some hospital that have a lower rate of ANC, they can use rapid test instead if they're not ready to using RPR. So it depends on hospital by hospital to decide. But the thing that I would like to mention here is to keep focus with the case that in the lower, in younger age, like less than 25 years old, or the cases that nurse evaluated that they may not come back to follow up, or they starting with late ANC. Those cases at the ANC, they should not miss. They should provide the same-day test, same-day treat. So this will help a lot to decrease the case of congenital syphilis. Thank you.
So it's like differentiated services model that we do for HIV, and then we try to target the high risk. And also, I think one thing that it might be able to implement is the lab alert system. For example, if you have VDR positive in antenatal care, if we have a lab alert system and then try to catch them the day after, rather than the next antenatal care, which is another month away, it might be an option to try to expedite and then treat mother in order to prevent congenital syphilis. Thank you so much, Professor. Thank you.
Thank you, Doctor. Our next speaker is Dr. Patriya Promsena. She will be speaking to us on gonorrhea in adolescents and young adults. She is an infectious diseases pediatrician and researcher at the Search Foundation.